I'm Emma Perry. I am the Mental Health Advisor for International Nurse Recruitment and a Professional Nurse Advocate. From August 2023, I set up and chair a national community practice for internationally educated nurses who are qualified professional nurse advocates or training to be a professional nurse advocate. The community practice is a brave space where internationally educated nurse PNAs who are training or qualified can have a sense of belonging, can develop their professional nurse advocate skills, can share their reflections, their innovations, their quality improvement, and support one another to deliver that professional nurse advocate role to the best of their ability, with that lens of being an internationally educated nurse. As part of the rollout for the national PNA programme, spaces were particularly dedicated to our internationally educated nurse colleagues, but there was no space to recognise them and bring that community of nursing together. So the community practice was set up to recognise the group of internationally educated nurses who had completed their professional nurse advocate training. The community practice is member-led, so although I set up and chair it, I have 4 co-chairs who are now taking over the lead of that meeting, and they were members that volunteered for that co-chair role. And we expanded the community to include internationally educated nurses who were doing their PNA training, because we wanted to recognise that through that training journey, they needed to belong, they needed the support, the development, the encouragement, the inspiration. So we expanded the terms of reference to include trainee PNAs who are internationally educated as well. The professional nurse advocate role was rolled out during COVID nationally to support the development and the well-being of our nursing workforce. Nurses are trained, they complete a level 7 module at accredited universities to learn about the professional nurse advocate role and how to deliver the advocating and educating for quality improvement model. The advocating and educating for quality improvement model is delivered by professional nurse advocates. And through restorative clinical supervision, professional nurse advocates support the development and well-being of our nursing workforce. It helps advocate for the patients, the nurses and the healthcare staff, promotes education and development of nurses, provides clinical supervision using a restorative approach to support well-being and development of resilience and coping strategies, and it enables nurses to undertake personal action for quality improvement. There's a growing evidence basis for the PNA role and the model, and it's recognising and that it does support nurse development, and our internationally educated nurses that go on to that professional nurse advocate training, it's part of their development and ongoing professional support. The community of practice, where it provides a sense of belonging, a network of clinical support to share best practice, it also amplifies the voice of our international nurse PNAs. So many of them come and present their work around their PNA work, their quality improvement programs, and it's maybe the first time they've presented and spoken to a group of people, but it gives them the ability and the confidence to then go and do that and talk about their work in other forums and other areas of their work and trust. It celebrates their successes. It inspires them to maybe do their own quality improvement project and take from another colleague a piece of work that they're doing and translate it into their area of practice. So it enables them to really stretch and take action, take personal action for their development and their practice. The best way of encouraging other trusts to get involved in the Stay and Thrive and really look at how they can create that sense of belonging, provide that environment to grow, develop, thrive, would be to look at the feedback that we've had from the community of practice from our members. They've 100%, when we've been doing feedback after every meeting, 100% said they'd recommend that community of practice again to other people that they would attend it. They've appreciated the platform. They've found it a space to share, to learn, to grow. They've taken tips for learning. They are feeding that learning back to their trust, to their other PNA leads and PNA colleagues. They've been motivated by it. They're going to go away. They're going to reflect on their practice. They've got tools to improve. And they've said that everyone's enthusiastic about sharing their experiences and successes. If I have 10 people in that community practice and those 10 go back and tell another 2 people, we have then amplified and encouraged other people to do that, and we've touched even more people. So why would you not want to have nurses that have a space to learn, to develop and grow, and then pass that on? Because it literally amplifies and magnifies 2-3-fold, and it only takes an hour and a half every month for those group of nurses to come and join and be part of that space, and the impact will be massive. Some of the work shared by our members around their PNA practice, specifically as an internationally educated nurse PNA for other internationally educated nurses, is to do check-in sessions and engagement sessions specifically for our international nurses, recognising they may not feel comfortable, or it might be different for them to speak up and speak out. So they've done a specific piece of work to check in and reach out with our internationally educated nurses, which then supports them to share their thoughts and reflections and any concerns that they might have or struggles that they might have. The members who are our co-chairs in the community practice, some of them had never chaired a meeting before, but now do that regularly and have the skills to do that. And they are looking at how they're going to develop and write up articles and do other presentations. So they are developing their education and presentation and sharing skills and their leadership skills. The workforce race equality standards data shows us that our global majority, Black and ethnic minority colleagues have less favourable experiences working in the NHS. The professional nurse advocate model and research and evidence from that shows that nurses who are PNAs, it's supporting their professional development, it's supporting their quality knowledge around quality improvement. They are able to advocate for themselves, for their patients, improve care and outcomes, and it's improving well-being through that restorative supervision. With the data that we've got around PNA evidence and RES data, why would you not want to support and enable our internationally educated nurses to take up that opportunity to support themselves, but then also pass that on and hand that forward? And that's what our internationally educated PNAs do. They hand forward that restorative supervision, the quality improvement support, the promotion of education and development for other international nurses. Even before, but particularly since COVID, there's a growing movement and evidence basis around the need to support healthcare staff wellbeing, and that healthcare staff wellbeing correlates with improved patient care and outcomes. The workforce for race equality standards shows us that our global majority staff have less favourable experiences working in the NHS than our white staff. Enabling and facilitating our internationally educated nurses to undertake the PNA programme supports their professional development, their well-being, enables them to deliver better quality of care and outcomes for our patients. And the community of practice enables them to bring all of that together, to have a brave space, to amplify their voice, to belong, to have that sense of community, to support one another. And it enables them to then amplify their voice and go out and work with other colleagues, internationally educated and white UK nurses, to help their development, their professional development, and provide restorative clinical supervision to support other healthcare colleagues' wellbeing and growth.